Welcome everybody to the session about homelessness and health, presented by Groundswell and Homeless Link. We'll introduce ourselves as we get going, so I won't do a great introduction, but I'm going to quickly talk you through the plan for the session. So can I have the next slide, please? Big thanks to my colleague Tess, who is sharing her screen so I can not have to concentrate on the tech. Much appreciated. So this is our plan for our session today. We're going to start with a quick welcome from me, which we're in right now, and then I'm going to hand over to my colleague Oz, who's going to talk about our peer-led approach to tackling health inequalities at Groundswell. Then we're going to move on to hear from our two project officers on our Listen Up project, who are going to talk about the insights that we gather from people with experience of homelessness through this really interesting and innovative project. Then we'll hand over to Jo from Homeless Link, who's going to talk about a piece of work that we've done in partnership that aims to bridge the gap between health and homelessness professionals so that people in the homelessness sector feel more confident having conversations about health with their clients. And then to wrap up the session, we're going to invite in one of our homeless health peer advocates, Groundswell, Manu, who'll be joining me for a conversation about his experiences. And then hopefully we'll have a bit of time for Q&A in the chat. One of our colleagues, the conference organisers, is monitoring the chat for us, again, taking some of the weight and the burden off those of us who are presenting, which is much appreciated. So do keep an eye on the chat. You can post questions and comments in there, and somebody will let us know what's going on. So I'm going to move us along without further ado. I'm going to introduce my colleague Oz, who's going to talk about peer-led approaches to tackling health inequalities. So Tess, if you could move us on to the next slide, I'll hand over to Oz.
Hey everyone, it's Oz. I work for Groundswell for HHPA, Homeless Health Peer Advocacy Services. I will talk to you initially about what Groundswell is, how we became live, and how it led to homelessness health, and what we do at the moment, and how that impacts people's life. Can I please get the next slide? Here, Groundswell exists to enable people who are experiencing homelessness to create a solution to move themselves out of homelessness. This also will benefit the whole society. This is what Groundswell believes. Most of our frontline staff and volunteers have experienced homelessness or currently experiencing homelessness. In the 1990s, someone called Mike Colony wanted to create a conference involving people experiencing homelessness in the UK and the United States. And that's how Groundswell became live. In the next 10 years, we created lots of newsletters, films, guides, forums, and these were all led by people who are experiencing homelessness, And this took us to 2000s, and then we started to get involved with health and the research in homelessness. That's how our HHPA services started to become live. We started the whole HHPA in 2010 after 10 years of work with the research and the health in homelessness. Can I please get the next slide? In Groundswell, we believe that the whole community will benefit from tackling homelessness. We also believe in people. Everyone has different values, different skill sets, and everyone can contribute to society regardless of their experiences, whether it be homelessness or anything else. We believe that there is no difference between us and them. We are all us. We are one. And we bring people together and find a genuine solution to homelessness. Groundswell's one of the core beliefs is the participation as well. Supporting people experiencing homelessness creates a solution for that. We believe as Groundswell that the solution of homelessness should come from people who experience homelessness. That's why we value participation and peer-led approaches in our projects. Can I please get the next slide? HHPA, I will talk about HHPA, what we do. It's a peer support service delivering one-to-one services for people experiencing homelessness to engage with health professionals and health professionals to engage with people experiencing homelessness in reach sessions as well. Not just in the appointments, health appointments, but we bring professionals from one side to deliver the health services on site. And in addition to this, we provide practical support. We take clients there. We help clients to build their skill sets and confidence to contribute to societal life going forward, and so that it would make them more independent for their health, and then they can contribute to society, and they can move out of homelessness. Tess, can I please get the next slide? In HHPA, we built it up initially in London. In 2010, we started in Westminster as a pilot project, and now we are delivering more services in 14 boroughs in London. You can see the boroughs here that we work with. Can I please get the next slide? This is a great chart, actually, what Groundswell does. We help people experiencing homelessness to attend their health appointments. We go there with them. We book the appointments for people experiencing homelessness. We support our clients to say what they want, what they believe about their health. So we advocate in the appointments for people experiencing homelessness. If you have any financial problems, which most of our clients have, we help taking people, providing taxi support or travel support to their appointments. Also, it's difficult sometimes in doctor appointments, we believe, that to understand the jargon. Our PR workers who are trained about this can translate those jargons to people experiencing homelessness, so they can understand what's going on with their health, and they can make an informed decisions about their health. Can I please get the next slide? I have talked about what Groundswell does. I want to focus on a little bit about the participation and why we use PR workers. PR advocates are people who experienced homelessness before, and they are volunteers or they are staff. Most of our staff experience homelessness in Groundswell. That's why we believe in participation, because we are creating change. We are informing the policies and procedures, and we are building a bridge between people experiencing homelessness and services with the health professionals. So our PR advocates can build that kind of bridge in between those two sectors. Peers have real understanding of the problems people face because we have been there before. We speak the same language. We are not an authority figure, so people don't scare from us. And we don't judge people because we have been there also. So when we have these values, also work with the professionals, we can rebuild trust and provide inspiration for other people who are currently experiencing homelessness to be able to move out of their homelessness. So we are basically frontline workers with lived experiencing of homelessness, so that we can help others to move out of homelessness. So we believe the participation works. Can I please get the next slide? So in the plain language, we train people. I explain why we do it and what we do it, and this is how we do it. We provide trained advocates to accompany people to their hospital appointments, to the health appointments, whether it be registering to GP, whether it be attending a doctor appointment or hospital appointment, or registering a dentist, going to dentist or optician. People might not want to attend those appointments because they don't feel valued, they can get discriminated against. But our peer advocates are there for people to advocate on their behalf and try to ensure that they get the right services that they need and they want. Can I please get the next slide? I also, this is one part of the HHPA. The second part is the Enrich program, which we run in homelessness settings. This program has been developed with other partners, actually. Initially, we started with vaccination work. When we start to roll out vaccinations, most of health professionals wanted to go to hostel and just vaccinate people there. And then we're like, oh, it's not possible because there is no trust between health professionals and the people experiencing homelessness, and people are not just an arm to be jabbed. So we created a different approach. We invited other health professionals to the hostels where people live, or the day center where our clients visit. So in that way, when we bring the services to people, we managed to get them, we managed to vaccinate more people. We offered them haircuts, sometimes music, sometimes sexual health tests. Lots of health professionals came together, and we promote dental care, opticians, and we try to bring all the people in one side, so that people experiencing homelessness don't have to travel to the health appointments or to the doctors to get basic tests. So this model is informed directly by feedback from our clients and other health professionals. So it's kind of co-produced as well, I could say, because everyone involved in the process was the client or people experiencing homelessness and the health professionals who are involved within this. And we tailored this specifically for our partners and the clients. Can I please get the next slide? I hope you now know what HHPA does, but the impact of this is invaluable, I believe. I put some data from a research in 2016 that we did. I'm sure the numbers have changed about COVID and the cost of living crisis. The numbers might have changed now, but this is from the 2016 survey and research that we have done. With HHPA, we reduced like 68% of our patient appointments. So if Groundswell weren't there, 68% of the appointments were not going to happen. But thanks to HHPA, that has happened and this saved like £60,000 for just one trust within a year of the program. Just one trust for 60K in 1 year, and 42% reduction on reliance on unplanned secondary care in 30 days following support. This means like £870 reduction cost per client over 6 months. Once we put the input, as I said, these figures were from 2016. I'm sure it might have changed by now, but every pound that we spend for Groundswell HHPA, it saves £2.43 for NHS. And peer advocates transition to employment, saving possible £24,000 per advocate a year. So people who experience homelessness, they wanted to volunteer for us. This volunteering opened more job specs for us, for our volunteers, and then they contribute to society and help themselves as well to move out of homelessness. And you can see the resources from the link that I on the bottom if you would like to. I'm sorry I bored you with numbers. However, I would like to go to the next slide, which would just summarize what it is. I think this is the best metaphor about the HHPA service. From one of our clients, she said, Groundswell are stitches that keeps homeless and health professionals working together. And literally, this is a bridge. We are the stitches getting people together and aiming to move people out of homelessness. Can I please get the next slide? I talked about HHPA a little bit, and I would like to, I needed to talk about Health Now as well. Hashtag Health Now, officially, it's the partnership work between us, crisis and shelter in national scale. We aim to achieve inclusive health system where everyone has equal access to healthcare they needed. We built this with crisis and shelter in Birmingham, Newcastle, and Great Manchester. In each area, we conducted peer research to find about local needs, because we know that people experiencing homelessness in London, in Birmingham, in Newcastle, or elsewhere is different. So we need to find about local needs as well. And then we set up HHPA services, we set up our local alliances, and help create and deliver local action plans. We also run a national peer network where we bring people together who are our volunteers from each area and more. And then this group would help directly to influence national policy makers. Can I get the next slide as well, please? We also have lots of resources that you can download from our website as well. These resources are mainly about health or people who are experiencing homelessness. And how we designed this is, again, participatory. People experiencing homelessness are volunteers, caseworkers, and health professionals. They all contributed to create these leaflets and the posters that we work. Also, it's not just posters and leaflets that we have. There are films, there are lots of podcasts, workbooks. You can reach all of them from our resources hub if you like to. You can search them by type, or if you like to receive, if you can't find anything there and you think that we could benefit from new leaflet or new source, please do get in touch. We can always work together to find out if we can do more resources together. Can I please get the next slide? This is just for you to see if there's any, if you would like to see further gain further information about HHPA or Health Now or our escape plan. We have a Clarissa film that we produced last year, if I'm not mistaken. We have lots of research publications. Please feel free to go to our website and just go around and browse it. It's I'm sure you can find very useful things there. That's it from me. If you like to contact us, these are the contact details that we can contact. Yeah. Thank you very much for your time.
Thank you, Oz, really appreciate it. Before we move on to the next section, I just want to mention a couple of things, particularly something that's popped up in the Q&A. Of course, the reason that the Homeless Health Peer Advocacy Service began in the first place, and a lot of Groundswell's work over many years, has been trying to address two things. One is the huge disparity, the inequality in health, the fact that people experiencing homelessness also experience disproportionately poor health outcomes, and indeed are more at risk of early death from treatable conditions. You know, it's terrific unfairness that we've been trying to address. And another significant reason why HHPA exists is because it's extremely difficult for people to access health services. The fantastic work being done by specialist inclusion health services up and down the country. And I want to recognise there are some pockets of really good practice. But the fact that Audrey's posted a question in the Q&A asking about clients struggling to register with a GP goes to show that despite a lot of hard work on a lot of people's parts, we're still having this really intractable problem of people not being able to get the most basic of healthcare support. On your point, Audrey, that I would direct you to the Groundswell website. We've got, if you search for My Right to Healthcare, you'll see we've got a range of posters and resources that people can access, which will help to get around this really tricky problem. We've done research on the topic. We talked to policymakers about it. It shouldn't be a problem anymore, but it is. So yeah, I'd encourage you to have a look at our resources, and something that I know is going to come up in the next session about some training that we're putting together might be useful. And before we move on, I just wanted to talk a little bit about some of the other works that Groundswell does, and that's going to lead in from Oz's presentation to Tess and Caoimhe's. So the work that Oz has described, the homeless health peer advocacy, very much an individual service delivery model where our advocates are out there every day supporting clients. Manu, that you're going to meet a little bit later today, has been out this morning accompanying somebody to a hospital appointment. You know, it's really significant and effective service delivery. We're also trying to address some of those larger problems and those bigger inequalities. So as well as our good health work, the health promotion work we do, the leaflets, resources, the HHPA delivery, we also have a strand of work we call Creating Change, where we are trying to change things on a big scale, really change the system that we're all struggling within and against at times. We do a lot of different types of activity to gather insight from people with experience of homelessness, whether that's peer-led research or the project that you're about to hear about, Listen Up. And then it's on us to try and turn our knowledge and our insight into action. We do a lot of work trying to knock on the door of policymakers, and sometimes we have a bit of success. But the key thing is that we want people to listen. We want people to hear the voice of people with lived experience and have that in mind as they make policy. So I'm going to hand over next to Tess and Caoimhe, who are project officers on our Listen Up project, to tell us about some of the insights they've been gathering.
Thank you, Lucy, and thanks, Oz, for your overview of the HHPA. It's really helpful. So yeah, me and Tess are going to talk a little bit about our project called Listen Up. We are a comic relief funded project, and we work with our partners on our radar. So, I mean, like most projects, we want to create long-lasting change, and we aim to do this by reaching key decision makers within the health, homeless and housing sector. We want these key decision makers to understand the barriers that people experiencing homelessness are facing in accessing health services. We also aim to create a movement of people experiencing homelessness, and we want these people to be part of the decisions that are being made and hold people who have power in creating policy and influencing practice, and we want them to be part of the decision making. Tess, can you move to the next slide, please? So those might sound like quite broad sort of aims of our project, but we have 3 different sections that we have broken it down into that we believe will create this long-lasting change. So the first is the power of stories. At Listen Up, we believe really strongly that stories can create change. We also have our real-time research. So this is research that's happening right now. We conduct research interviews in hostels, day centres, and wherever we can reach people who are experiencing homelessness. And then also our rights-based training, we call this Shifting the Power. Can you change the slide, please, Tess? Thank you. So at the moment, myself, Tess, and our colleague Matt are going into hostels, day centres, like I mentioned, and we are interviewing people with experiences who have experience of homelessness. We are asking them about their access to healthcare, how they access services, how they found it, what's helpful for them, and what has maybe hindered them at times. What we do is then we take all of this data, we write up our findings into something that we call insights. We also take a lot of our stories from our community reporters, and we want this to provide evidence to people who are actually making decisions within the health sector. Yeah, Tess, could you move on? Thank you. So we've spoken to around 100 participants, and we want this to be nationwide. So we're looking at London, Manchester, Bristol, Norwich, wherever we can reach people, basically. And the topics we've covered so far have been mental health, drug and alcohol, dependency and recovery. At the moment, we're looking at digital inclusion and exclusion. And our next topic is the cost of living crisis. Just to give you a little bit more sort of insight into some of our insights, one that we've recently produced is drug and alcohol dependency and recovery. We covered 6 main themes which sort of emerged from our findings. You can see them on the screen and have a read afterwards yourself, but sort of the findings showed that relationships with housing, relationships themselves, healthcare, access to services, stigma, and experience of services were all things that hindered or helped someone's recovery in terms of drug and alcohol. I think it was interesting to look at sort of relating back to what Oz was talking about with HHPA, the role of peers and mutual aid, people are saying are really, really important to sort of helping their journey to recovery. So it sort of highlights the importance that peers can have in helping people sort of take the steps that they need to take towards recovery. If you want to read a little bit more about our insights, please do. I used to be a frontline worker, and reading these insights were really, really, really helpful. And I would have, you know, liked to have a resource like that when I was working in services. Tess, could you move on, if you don't mind? Thank you. And Tess, your bit.
Thank you, Kiva. I get to move my own slides on. This is going to be nice. So I'm going to tell you a little bit about our community reporting and the rights-based training that we are going to have coming up. Our community reporters are people who are currently or have experienced homelessness at some point, and they are all over England. So from York to Brighton, I think, is the reach of reporters we have at the minute. Our reporters will sort of blog about their own experiences in relation to what's going on in the news. They respond to things that have happened to them. They also go out and interview people. Most recently, there was an interview with somebody who delivers a day centre and sort of talked about their service. And they do it in a variety of different means. And most of them are written, but we also have some audio reports. We have trained a group of the reporters to do digital storytelling, where they're able to film, edit, and create their own films. And we have a few of those on our hub at the moment that you can go and look at. Some use images, so sometimes there'll be a picture that they think sums things up. They'll take a photo and put it on there. We also have podcasts. We did a range. We did 3 podcasts on recovery recently. We also had a podcast with Prince William from the last Comic Relief Day a couple of months ago, where 2 of our reporters interviewed Prince William about why he cares about homelessness and why he should care about homelessness. And we do it because our volunteers can reach peers. They've got greater access to what's going on than we do working in services. They actually see it, they live it. And because we want to amplify their voices. We don't want to give them a voice, but we want to basically give them a megaphone and go, you know, these are the people we need to be listening to. And we have the Listen Up Hub, where all the stories are compiled. We have a newsletter if you want to do that. There's links at the end of these slides. When we were putting the slides together, we were quite optimistic about time, and I fear we are not doing too great for time at the minute. So this, what I was going to show you.
Tess, I'm going to jump in and say you've still got 10 minutes, so I think go for it.
Let's see if I can. Let's hope the sound's going to work. This is an animation that we created. It features 3 of our reporters talking about being heard in services, mostly in healthcare settings, but there is one who talks about their experience of being heard by homelessness services. Fingers crossed this will work. The audio doesn't start immediately.
I feel being
Can you hear that?
being an ethnic minority, and also being unsure about my sexual identity create a lot of barriers for me to access health services. If you're homeless or trying to get information, it's very difficult. In my 29 years of experience, I've probably been heard by a health professional once. It's really difficult getting them to take it seriously. All they want to do is just throw medication at the problem. My thoughts and feelings should be important. I feel confident in my ability to describe what I'm trying to achieve and also what I think would make the situation better for other people. But when you are part of a marginalized group, your voice becomes less and less clear because it gets muddied in with everyone else.
I was in support accommodation and my son couldn't stay with his mother anymore. I spent 3.5 years sleeping on the floor while he stayed with me and went to school. And he knew this, but I couldn't communicate it. Accessing services was not a problem. They were seeing me, but the service I got wasn't great. I think because I wasn't a problem, I was so quiet, I got pushed to one side. I was such a bad place, I couldn't talk. I was incapable of speaking and standing up for myself or talking to someone. I couldn't look them in the eye or anything. Different personalities use different methods to try to get their message across. Some good, some bad. Personality should have nothing to do with it on both sides. You should be governed by needs. I know I'm on a time limit. I know I've got 10 minutes. There are moments where I've felt I've been asked questions directly to me, where boxes have been ticked. Then as soon as there's been enough ticks, they say, all right, yeah, I know what to do. This is what we're going to give you. I'm kind of mid-sentence, and it's kind of, I haven't finished telling you yet. Because all I've done is give me enough evidence for you to decide what it is that you're handing to me. But it's not never actually what I want, because I haven't had the time to be able to understand. Medication's not really the best route for me to be able to cover it. Knowing that someone heard me, knowing that maybe I didn't quite get the answers I wanted, but somebody did listen, that's so important for me. I think the handcuffs that a lot of professionals are tied to, if we could just give them a set of keys to unlock some of those handcuffs, I think you'd see a lot better system.
So that was an animation that was made last year with 3 of our reporters. And it kind of informs what we do and the sort of topics that we look at. It also informs the topics that we look at in our insights. So we look at what is affecting our community reporters and go out and research it further. What comes up quite a lot is about rights, which is the third part of our programme. Sorry, tripping over my words. Third part of the Listen Up programme. And we are in the process of developing and creating some rights-based training, which will be delivered for everybody involved in homelessness and health. We aim to deliver it to people currently experiencing homelessness and for people who are working in services to ensure that everybody works together so that people experiencing homelessness can get the rights that they are owed, what they deserve, the kind of care that they should be receiving. It will be available for online workshops and in person from September. I am currently writing it, not currently, but yeah, writing it. So you can get in touch with us if you are interested in receiving it. There will also be an online learning platform, kind of like BBC Bite Size, for people who are experiencing homelessness, who will just want to dip in and just go, I've experienced a GP saying I can't register, what do I do? And they will be able to go on and within 5 minutes know what they need to say. And in quite an interactive way, and we're developing that at the moment as well. There will also be some handouts as well that people will be able to take, so they'll be able to find out on this topic what people's rights are, where they can find out more. And we hope from September onwards, this will all start rolling out. And if you keep an eye on any of these, you should be able to find out more on our Groundswell social media channels. And that's Listen Up.
Thank you so much, Tess and Caoimhe, for that. It's a really superb project. I really do recommend going to the hub and having a read and a watch and a listen, because there's just some superb stuff in there. And of course, it's really important to us that it has an impact. So if you learn something from it, you can take that to your teams, take and share with your colleagues or your contacts locally, then all the better. I've just answered a question in the Q&A about whether there's as much of an issue accessing mental health care as physical health care. And I said, yes, absolutely, and mentioned that Listen Up have just recently created an insight about that particular topic. And loads of the reports on the hub are about mental health and the huge impact that homelessness and poor quality housing has on people's mental health, and just how difficult it is for everybody at the moment, whether you're housed, homeless, in temporary accommodation. It's just very, very difficult at the moment. But I've put some resources in that Q&A, which I hope will be of use. I'm going to hand over now to Jo from Homeless Link. I'll let you introduce yourself, Jo, and the piece of work that we've done together. But I hope that this will be useful to those of you working in client-facing services to help you have some of those tricky conversations. Over to you, Jo.
Thanks, Lucy. Hi, everyone. It's lovely to be here. Thank you so much to Groundswell for inviting me. So yeah, I'm Jo Prestidge. I'm the Head of National Practice Development at Homeless Link. And I assume most people know what Homeless Link is, but if you don't, we're the membership organisation for other charities and local authorities working to end homelessness in England. And I think we have around 850 organisations that are members of ours. And my team is all around kind of influencing change in practice, introducing new ideas and ways of working, and making sure that you guys on the front line have the information that you need. And we have all been frontline workers as well, so we know what it's like, and we're trying to kind of support you to do your roles as well as possible. So I'm going to talk about some work that we've been doing with Groundswell and direct you to a few resources around how you as frontline workers can improve the support you provide to people experiencing homelessness around their health and care. Just before I start, there is someone drilling in my house, so I really hope that you can't hear it, but if you do, maybe Lucy, you can tell me to speak up or something. Right, so Tess, can we move on? Thank you. So the work that I'm going to talk about mostly is through a project that we're part of called the Health and Wellbeing Alliance, and that is a national alliance of voluntary and community organisations and social enterprise organisations that represent different health inclusion groups. So people who face groups of people that face the most inequalities in terms of their health and care. And it is managed and funded by the Department for Health and Social Care, the UK Health Security Agency, which replaced which replaced Public Health England, and the NHS England. And so we as a national platform meet together and look together of kind of cross-cutting needs that are faced by people, and make sure that we're feeding in on behalf of our populations to those government departments and using all of the kind of evidence that Groundswell generate. But also we deliver different projects that are supporting our population specifically. So that's what I'm going to talk about. The drilling has started. It's like being at a dentist. So move on, please, Tess. So some of the projects, so it's Groundswell and Homeless Link, but we also have Pathway as a partner. So we represent people with lived experience, frontline organisations and inclusion health professionals working in homelessness. So we've got a really good kind of network and consortium, and we call ourselves the Homeless Health Consortium. And the projects that we've looked at over the last couple of years are improving mental capacity assessments made by staff in accident and emergency settings. So we've produced an e-learning tool for them. We've done some work recently on looking at the barriers to dental care for people experiencing homelessness and some of the good practice examples of where people are trying to increase access. We did a project on vaccine uptake around COVID-19. We earlier this year did something around suicide prevention and postvention and making sure that there's resources and information to help you in your work. This year, we're looking at cancer screening and treatment for people experiencing homelessness. And the one I'm going to talk about is about improving conversations around health. So move on, please, Tess. So we called this project Bridging the Health Gap. And what we wanted to know was what's happening in the voluntary and community sector, homelessness sector, in terms of the conversations and support that frontline workers are giving people around their health and care needs. So the first stage of this work was to try and find out that, basically, and we brought together frontline workers from across the country into some focus groups, and what we found is that inevitably, and you will know this, you spend a lot of your time talking to people, and we've lost a lot of time supporting people with health and care needs. But actually, a lot of that work and a lot of the conversations are normally around emergency health and care needs and supporting people to appointments. But the people in our focus groups said that actually where they lack confidence and where they're not so sure is about how to initiate conversations generally around people's health, maybe sooner before it becomes an emergency, or if there are other things to talk about, because there was a concern that that might conflict with people's personal choice, and that it might affect the trust that could be built or is being built up. There's also a concern that frontline staff shared with us about the responsibility to act when you see someone's health and care needs deteriorating with their personal choice. Can we move on, Tess? Thanks. So what we kind of thought about was the fact that conversations around people's health should begin earlier on when someone's in contact with services, not just when there's an emergency or when things are going bad and deteriorating, and that those conversations should be proactive. But actually what's missing is frontline workers' confidence and knowledge of how to have those conversations. We also kind of realised and mapped what training is out there, and a lot of the training on health care is very issue specific, so it's about specific health needs. So we knew that there was a lot of stuff out there, but what the gap was about people's confidence and knowing how to have those conversations. Thanks, Tess. So what we did was we brought together a advisory group of people from frontline services, inclusion health professionals, and people with lived experience via Groundswell to develop a suite of resources, a toolkit that is all about improving confidence and skills of having conversations in services with people. And they are all available on the Knowledge Hub, and there's a link there. We move on, Tess. So the first thing we did was we developed a workshop that you can hold in your team meetings or your in your services. It takes about an hour to do, and it's all about kind of the myths around access to healthcare, some of the barriers that people face, thinking about what good support looks like and how to have those conversations. And it's got videos and exercises and reflection tools in there. So on the website are slides that you can use in your workshop, and also a workshop plan so you can carry out that workshop yourself. Thanks, Tess. And the other things we did, so we've produced a directory that has all of the different resources and training that we knew of that we've done in our mapping, so you can access if you're working with someone from a specific for a specific demographic, or they've got specific health needs like mental health or physical health or learning disability. We put all of that into a directory so you can go and find that. We produce a template for you to fill in with useful contacts in your area. We worked with Groundswell to produce a briefing on their making all contacts count through advocacy approach, which is using every kind of contact and interaction you have with people as a potential opportunity to use advocacy skills to help them to think about their health and discuss their health. And we also produced this resource on the left. It's called a 7-minute briefing, and that is for managers, so for your managers, or if you are a manager, to help them support you to have conversations about health, so that kind of level up. Thanks, Tess. And then just before I finish, because I always like to get added bang for my buck, a few other things to let you know of that Homeless Link have on our Knowledge Hub. So we have some free e-learning training and we've got 6 modules on safeguarding and the Care Act. They're about half an hour each. They cover the legislation and how you can use it in supporting people. They also look at people's rights if they are if they've got restricted eligibility because they're non-UK national and their immigration status is unclear, if they're a care leaver, and also for people leaving other types of institutions. And we also have tons and tons of guidance on all different subjects, including autism, learning disabilities, brain injury, the mental health system, how to access it. Thanks, Tess. And very finally, I think, our podcast. So we have a podcast that's produced by my colleague Jo, who I think is on this call. Hi, Jo. Called Going Beyond, and it's all about trying to help you in your role. So the first series is all about relationships-based approach and why that's really important in terms of trauma and attachment in building that trusting relationship. Our series 2 was really, really popular. This looks at staff wellbeing and looks at that from different angles and has really practical ways to help you feel well at work. And the series that we're recording at the moment is around health and care needs, and we're focusing on things like self-neglect, hoarding, brain injury. I think that's it. Is it, Tess? Yes, thank you. Thanks so much.
Thank you very much, Jo, for that very helpful, concise summary of a huge amount of work that was done. And I really would commend anybody who's here who is working with clients experiencing homelessness who are struggling with their health to check out those resources, because we all know it can be extremely difficult just to have that conversation with confidence, to know that you know what to recommend, that you know what you can't promise and what isn't available out there. It's really tough. And I noted particularly that there's another question in the Q&A from Apollos who's asked about supporting clients who have mental health concerns or issues who are not yet or not willing to engage with relevant professionals. I've answered another question in the Q&A about mental health and linked to a leaflet that we produced with Mind, which I would recommend checking out. Hopefully somebody will pop the link in the chat while I'm talking. Because that very much addresses the issue for people of what to do either while you're waiting, can be a considerably long wait for formal statutory services to kick in, but also relevant to people who are not yet willing to engage in those services or to get themselves onto lengthy waiting lists. I would also say, in answer to that question and others, that we've generated a great deal of insight about the mental health struggles that people face, either as a result of their homelessness or for myriad other reasons, and some of the ways that people can try to shore up their mental health in one of very, very difficult times. Before I move on to have a conversation with Manu, who's just stepped into the next room, I want to point everybody to the chat as well, where Naomi has helpfully emphasise that all of the links that we've shared in our slides today will be shared on the Frontline Network website after the session. So as well as this being available via recording, there will also be links for you to look at. So just checking there's anything else in the Q&A. Oh, one other thing that I'm going to ask for help from people attending. So Joyce has put a question in the Q&A that I've not answered because I can't come up with anything. So Joyce has asked for any sources that people can recommend of funding to get somebody dentures because they can't get an NHS dentist. That's something I'm sure lots of us have experienced, whether it's in a professional setting with clients or in our own lives or with our own families. It's extremely difficult out there at the moment. I would encourage, if anybody does have any questions, that you do pop over to the Q&A, and I think anybody can suggest answers as well. So if you're one of those people who's found a really nifty workaround for getting people access to NHS dentistry or to sources of funding, then I would ask you to please to visit the chat.
The only thing I thought, Lucy, was if Joyce puts where in the chat box what location you work in, we might be able to see if that maps across to one of the modules that we've found through our inclusive dentistry work, or at least close, and see if there's a route in through kind of a more kind of social enterprise approach to dentistry. Thanks.
Nice one. I hope Joyce is still here and is able to pop in the chat and the Q&A where she is and check out those resources. And I noticed that somebody has also put in that you can liaise with social care people about this and had some success in Liverpool. So if if nothing else comes out today, hopefully Amelia's been able to support Joyce with her dentistry issue. I'm afraid the person I'm hoping to do a quick Q&A with has just stepped into the next room. Just marvellous timing. But if anybody has any other questions that I can answer, or any of our panelists can answer while we're on the call, then I would invite you to put it into the Q&A box.
Can I just respond to the mental health question, Lucy? So I think some of the guidance that I mentioned, so the access to mental health guidance and the suicide prevention guidance does have stuff in there that might be helpful in terms of supporting someone that's maybe not feeling very well, what you can do in your role in the moment in terms of making people feel safe and building that trust and like containing people. But I believe, and I'll have to check, but I think we're recording some webinars that will be on the website soon about how to support people in distress and thinking about perhaps other services that might be available to them. Keep an eye out.
Thank you, Jo, that's fantastic. And so now for the final portion of the session, I'd like to introduce my colleague Manu, who's a homeless health peer advocate here at Groundswell, and has been doing the role for quite some time. So I'm hoping it's going to have some really useful, I know it's going to have some really good insights for us. I was going to kick off with a question for you, Manu, and ask how you became an advocate.
Good afternoon, everyone. I was homeless myself for 12 years, Westminster. Your connection somewhat, and it was my house for 12 years. And I lost my job, so I ended up on the street. And the question, how come I ended up volunteer?
Yeah.
In 2011, I was standing outside connection, just collapsed. And one of the nurses, God bless her, from connection, she put me in the hospital. And Groundswell, Mr. Dennis, he was looking after me. First time I met him, I told him the F word. Because when you're on the street, you don't trust nobody. And then bit by bit, I started trusting him. They were looking after me. And then in 2016, I moved to my place. I got a place now, God bless. And I was in connection. Groundswell approached me. He says, I was doing volunteering connection. They approached me, they said, why don't you do volunteer with us? I said, I'm gonna try. I walked to the office in Vauxhall. I saw John, my mate John, he was on the street with me. I said to myself, if he can do it, I'll do it. So I've been with Groundswell since. And I think second best thing happened to me in my life, volunteering with Groundswell. First thing, my daughter was born. I was extremely happy. And then volunteer with Groundswell. There's no pressure. You do what you have to do. You look after your client. With me, I don't know, most people think the same. With me, my client comes first. And I'll give you an example. In the morning, you don't talk to me. If I don't have my coffee, nobody speaks to me. Today, this morning, I had a job and I woke up late. I cannot understand late. I cannot understand it. Whatever I do, I have to be on time. So I said, coffee or my client? No, my client first. I left my house without coffee. I told my missus, she said, no, you cannot survive. So, yeah.
You can confirm you have now had a coffee.
I have 2 coffees. I'm good. And like I said, volunteer with Groundswell is the best thing. And
tell us a bit about the biggest challenges that your clients face that you support them with.
My number one challenge, for me, my opinion, the reception at the hospital. I'll give you one example. Just after the lockdown, when it started easing up a bit, no, sorry, just before lockdown, my client I was working with, he had a mental health. So we went to the hospital, the lady reception, she said, have a seat. So we sat. My client, he was on the street. at that time, that day, he was on the street sleeping rough. So the lady at the reception, she came with air freshener straight in my client face. So since I've been doing volunteering, the reception at the hospitals, I'll say 75%, they don't know how to treat people on the street, rough sleepers, or people with mental health, whatever. They don't know how to deal with them or treat them. I have great respect for the nurses and doctors, but with the reception, I'm not saying all of them, some of them, and in the hostel as well. Some hostels, they're for the money. They don't care about the homeless. If you have mental health, if you're homeless, or you whatever, yeah, they don't care. I took a client. I meant to take a client to the hospital at 7 o'clock in the morning. Pick up. I like early jobs. The lady, she was on the phone, playing the games. The reception, the lady in the reception. I found out later she was agent from agency. They're not there from the heart, they're there from the money. You're homeless or not, they don't care.
Thinking about the role of an advocate, and somebody put a question in the Q&A for you, Manu, about how Dennis was able to gain trust with you all those years ago, but also how do you go about gaining trust with your clients when you first meet them, when you're working with them?
I know it sounds a bit silly, but for me, that's what I like early jobs. I like to get there early, at least an hour earlier, so I can talk to my client, take him for coffee, have a chill. You know, it's not one time, twice, at least 4 times. You know, to get trust. It's not like go 5 minutes before time and then pick him up, take him to hospital. No, I like to have a conversation, talk to them, like Dennis did with me. Not the first day. The first day I told him to go away, but after that, he came early, take me for coffee, chill, talk about everything. That's what I do with my client. I like to go early. People say to me, why do you come early? First of all, mind your business. Second, I like to talk to my client. So we don't talk in the hostel. I'll take him coffee shop because he needs privacy. In the hostel, there's no privacy. So hostel or sit outside in a coffee shop and just talk about everything. That's why they gain your trust. And I work with Edward also for a long time now, at least 6 years. They know me. They know what I do. They talk to me. They can trust me. And I know some of them, they want to speak with me. So, yeah.
That's a big hostel in London, I think,
Yes,
for
it is.
some people who might be elsewhere. Could you tell us a little bit about the sort of work that you do with clients? So, for example, some of the health problems that you help them with, or some of the types of appointment you accompany them to?
I work with many people with many health issues. I work with mental health. I'll give an example. I worked with a guy, Algerian guy. He doesn't speak a word in English. Because I'm Algerian, I can help him. I work a lot with Arab people who speak Arabic. I speak 3 languages, but I cannot write or read. So I'm happy with that. This guy, Algerian guy, I worked with him for like almost a year. Every Thursday, we go to chemotherapy. He had a cancer. He was a young man. And I remember he always buy pastries for the nurses. He's a nice guy. I just had a phone call one day. I don't know how he kept my number. My real name is Jamal, but people call me Manu. Yeah, I'm cancer free. So I worked with the downsides with my job. The only bad thing of what I do, it's not bad thing, but I worked with a lot of people I know from the street that end up passed away. And it hurt. People say, don't take it personal. It is personal to me. Good or bad, it is personal to me. So that's the only downside. But yeah, mainly I work with people with health issues, mental health issues. So yeah.
And you talked about supporting that client to go into chemotherapy. You took someone to hospital this morning. How do your clients feel about going for health appointments?
Some of them anxious, if that's the word I mean. Some of them nervous. Some of them, the only reason they don't want to go to hospital is because the reception, people at the reception, they don't treat them like a human being. Because some of them have, like I said, have mental health. You go hospital, reception, they treat you bad, you kick off, obviously. I do. If someone treats you bad, I'll kick off. But yeah, that's, but when you're with them, I'll give you an example. I shouldn't say this, but I'm gonna say it. I'm straightforward. I took a client one day. His appointment is at 11 in the morning. The nurse, she said 2 hours. He started kicking off big time. Instead of calling police or security, I shouldn't say that. I shouldn't do that, but I done it. I give him a cigarette. I said, go outside. I'll deal with them. Just get fresh air, chill out, and he come back 15 minutes later. It was fine. I don't want him to lose appointment for his own good. So yes, the issue, I was gonna say last conference, nurses conference, why don't you invite people from the reception in the hospitals to come to the conference and they learn what we do, they learn how to treat people.
There's so much in what you just said, Manny. I was reflecting that we often spend time, our advocates often spend time keeping people company while they're waiting. So if they've got a long wait for an appointment, and that keeping someone company, keeping someone entertained a bit so that people don't miss vital appointments is a hugely important bit of the work. And I also really think what you were just saying about people feeling anxious, they're worried what kind of reception they're going to get. This whole piece around people fearing this being stigmatized is so significant. It's something that Groundswell do loads of work. You know, all of our health advocacy is around breaking down that stigma.
Sorry, can I give an example, please? I'm really sorry, guys, to bother you. In 2011, I was diagnosed with TB, kidney infection. I lost my kidney. Dennis was looking after me. I was waiting for Dennis at the hospital. I walked into the reception, the main reception, the University College Hospital. The lady at the reception, you know what said to me? She's at the reception. Because I was losing weight, I was everything. She saw me, she said, you have AIDS. But just looking at me, she said, you got AIDS. You see, that's what I'm trying to say. They don't know how to talk to people, treat people.
We know that there's so many different layers to stigma, aren't there? Because there's the stigma associated with experiencing homelessness, drug and alcohol, if that's involved, huge stigma around that as well. Mental health, particularly over years, we've learned a lot more about those stigmas, and that multi-layering can be so off-putting for people, and it can cause people to receive poorer quality care. So important. Is there anything, we're right up against the end of the session, we're right up against time. I just want to ask if there's anything that you'd like to say that the people watching today are going to be working in services, working with people experiencing homelessness. Is there anything you'd like to say to them about how to support their clients with their health?
How to support clients, just be honest, just be kind, and always treat them with respect and dignity, and I forgot the other word, respect and dignity, and just give them a time. Just give them a time. They need help, they need company, they need a friendship. Not friendship as friends for a long time, but just there for them. Just be there for them.
Brilliant. Thank you so much. If any of the other panelists want to leap in with a final comment, you're very welcome to. I'll just give you all a second chance and then I'll wrap up. I don't see anyone Oh, here we go. Joe's off mute.
Well, just to say thank you to Manu. I think what you've shared is really powerful, and it just reminds you just how important just like human connection is. In a lot of what you've said, it's the power or the kind of the power of human connection, but when people don't connect, the kind of the effect of that on people. So yeah, thank you.
You're welcome.
Thank you, Joe, and thank you, everybody. Thanks to Oz, who had to dash off early, to Tess and Kiva, and to Joe. I don't know why I keep getting blurred out, but hopefully that's not too distracting and you can hear me. I promise I'm still here. And of course, a huge thank you to Manu for coming in and talking about your volunteering role with Groundswell. Thank you very much to the Frontline Network for inviting us to do this session, which I hope you've all got something from and found interesting.
God bless. Thank you so much. Peace and love.
Thanks,
God bless.
everybody.
Thank you. Bye-bye.
Bye.